when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs.
The lad who was driving got blood coming out of his face.
To save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them.
He's absolutely locked in. Okay, good.
To deliver cutting-edge emergency medicine.
Yeah, we're just going to go to sleep. He's not looking particularly good.
At high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
The vehicle's actually balanced on its front end in a tree. One patient currently trapped.
She is a 76-year-old lady.
A bit bluey around the lips, so keeping a really close eye on her to make sure she doesn't deteriorate.
High risks.
I'm struggling to get you anywhere close. OK, we're down in Central. You're cleared out and I'll leave the disc up and running.
We're going to go by road to LGI. Mark?
Yes, I'm doing the run.
No, you're not doing a run. You were doing a run.
And high drama.
Angle grinder to the upper right thigh.
Sorry, mate, it's going to be a bit sore, OK?
It's like a bit of hawker.
Just pop a little drip in your arm, then we'll get you some painkillers.
You could potentially bleed to death if you don't act within minutes.
OK, wind sort of come out quite significantly actually. It's just on the nose, but I'm happy to accept the crosswind. OK, so speed's good. Height's good. We'll go committed there, guys.
Helimed 98 is returning to the Nostell Air Base. But dispatcher Tyrone is monitoring a new 999 call.
There's minimum 2 occupants and they're in the box.
And are there any obvious injuries?
Yeah, the lad who was driving got blood coming out of his face.
No, Edis. Just listening to a call. A19 junction, A172 at North Allerton. RTC trap.
What did it say? North Allerton 172? Yeah.
That means they're going to have to head straight back out. The accidents happened on a stretch of the A19, one of North Yorkshire's busiest roads.
We got RTC entrapment. I've just got a brief of the incident.
Helimed 98 is racing north at 150 miles per hour.
It's one caller, car RTC, halfway up a tree, 2 patients trapped. They are conscious and breathing, but one has got
Facial injuries, bleeding quite bad, but they both are trapped.
Yep, copy. Car versus tree, 2 patients trapped, both conscious. Give you a shout when we get nearer.
Flying Dr. Chris has unfortunately seen many incidents like this before.
When a car hits an object at speed, unfortunately the organs keep moving. So actually you can have quite severe injury to the internal organs and structures without really seeing much damage to a car or even to the outside of the body.
999 reports of accident locations are often sketchy, and today they are wrong.
This is the 172 junction.
Just here?
Just beyond here.
Yeah.
So it might be lower than what it said originally.
Ah, right, yeah, there does look like there's a bit of standing traffic there, doesn't it? Northbound lane is...
Yeah, that is all shut. Yeah.
Then paramedic James spots the car.
Incident's behind that tanker, innit?
Yeah, looks like it.
Pilot Jeff must find a place to land.
So gaps down past that white van, but nothing close to that.
I reckon that white van's going to be making like it's a ditch, if not otherwise, looking at it.
Yeah, looks like it, doesn't it? That'll do there, won't it?
Yeah. 98 landed.
The team are joining firefighters in roadside undergrowth, trying to free a pensioner from the car.
We're going to find a way through these nettles. Who wants a bit guinea pig?
James and Anthony have arrived just in time.
Air Desk Medic 1, quick update. Vehicle's actually balanced on its front end in a tree. One patient just being extricated and mobile into a DCA. One patient currently trapped.
A local paramedic is bringing them up to speed.
So she is a 76-year-old lady. Passenger in the car.
Okay.
Airway's been plating throughout, but been complaining of shortness of breath, chest pain, right arm pain.
Inside the car, Julia Golightly has already had some medical care.
There's an off-duty anaesthetist passing by and initially found her suspended, a bit bluey around the lips, so
So we're keeping a really close eye on her to make sure she doesn't deteriorate.
Julia's age is against her. There are concerns for her breathing.
So if we get her out on this and put her straight on the cot?
Yeah.
Assess her on there. Okay.
Julia is semi-conscious.
We're just getting her out now, and we'll put her on the stretcher so we can assess her properly.
Her broken arm is obvious, but there are concerns she may have other undetected injuries.
So we're going to scoop her straight off, guys, if we can, so don't disappear. So we're going to go to patient's left. Ready, brace, roll, 15 degrees, and pause. Clip together.
No.
Ready, brace, lower.
No.
Julia, my name's Anthony. All right, one of the paramedics.
Yeah, okay.
Okay, do you remember everything that's happened? Do you think you were knocked out at all for a bit? Where's it hurting?
You're right,
Not over there. So it's hurting in your chest, is it?
Stable.
And that arm. Anywhere else?
She's working really hard to breathe, isn't she?
Do you have any breathing problems usually?
No.
No, usually fit and well? Don't take any medication? No.
For Dr. Chris, her breathing problems are a mystery. Her SAT, the oxygen levels in her blood, are low.
Julia, do you feel like you can breathe at the minute? Do you feel like it's difficult to breathe? It's hard to breathe.
So currently, airway's fine, breathing's a problem, subcutaneous emphysema, SATs are low despite high flow oxygen. So she's got respiratory failure. So we'll just give him time to get that cannula in. If the SATs still stay rubbish, I think we should tube her.
The team are concerned. It looks like a chest injury has caused a collapsed lung.
Sharp scratch, darling.
Then her oxygen levels begin to rise.
I think at the moment, like you say, although she's struggling, we're saturating at 99%.
Yeah. Okay, so things are a bit different now, aren't they? So SATs are up. I think we go via DCA to James Cook.
ADS Medic 1, quick update. Elderly female, query left-sided chest injury. The intention is that they're going to go by DCA with the crew.
They're going to go to hospital by road.
Julia, we're going to be moving now. OK, we're going to get you in the ambulance, we're going to get you straight up to James Cook.
It will allow Dr. Chris to operate or anaesthetise Julia more easily if her breathing worsens again.
If she drops the SATs, what we're going to do is we're going to decompress that left side. If that doesn't work, we're going to RSI her, put a tube down and do a thoracostomy.
She's going to be taken to the major trauma centre in Middlesbrough. The crew are alerting hospital doctors.
It's Anthony, one of the Air Ambulance paramedics. We're coming in by road, so would you be able to put us through to the A&E so I can give him a map mist?
The team will monitor Julia closely.
So you've got blood 1 and 2 and corpals?
1 and 2, monitor, yeah.
That's fine.
Just a suction.
All right, mate.
All right.
If her breathing problems are caused by internal bleeding, she is vulnerable to a cardiac arrest.
Julia, you're all right, you just relax now. OK, we're pointing in the right direction, so we're going to get straight up to James Cook. OK?
It's a 15-minute drive, even on blue lights.
Where's the worst of your pain? Is it across your chest? You any pain in your tummy as you just laid there? On that left side?
Chris is preparing for the worst.
I think if things change, so we decompress that left side, then we'd intubate her. To intubate her, I'd be happy intubating as we are in the DCA, because she doesn't look particularly difficult. We've got suction and other bits. It's probably worth John just checking that everything's here.
But Julia appears to be regaining full consciousness.
We'll be at the hospital in about 5 minutes, OK? But once we get there, there'll be a load of doctors and a load of nurses. I mean, there'll be probably about 15, 20 people, OK, who are going to look after you. Is that all right with you? Yeah?
Thankfully, she's made it to the James Cook Hospital.
Steady, left.
She's going straight into resus.
So we've got 76-year-old Julia. Injuries-wise, she's got fractured right humerus, a closed fractured right humerus. Left side of the chest we were concerned about. She's got reduced air entry, there's some surgical emphysema. She's got some bruising across her abdomen. Left side of her hip and her pelvis is also bruised. She's had a Gramma TXA and she's got a pelvic binder on.
Julia's condition is very serious. The fight to stabilise her and identify her internal injuries starts now. In Pontefract, paramedics are racing to the scene of a medical emergency. A runner in the local half marathon is fighting for his life.
I ain't got a good reference, but it's over in that direction. If you fly over there, you'll see it.
Okay. So what's the story? Someone, marathon runner?
Half marathon runner collapsed. They don't know what mile he's at.
Right.
Someone's probably dived on him doing CPR for him.
It depends how close the medical team were to start with.
The course covers 13 miles through the streets of the town.
Keep your eyes peeled, guys, because we're not sure where it is.
Yes.
Oh, there you go. The visual now, just down below 11 o'clock.
If they close the road, I'll put it on the road. And then we just go down there.
Can you do me a favour and quickly get over the CS?
If you get someone to shut the road off, we'll run on the road, mate. We're struggling to find some back.
The runner is being given CPR by ground paramedics, but pilot Mark can't find a place to land.
I've got wires going across the road, and I'm compromised here too. I'm struggling to get you anywhere close.
Unless we drop you two off.
Yeah.
And then we'll come into the orbit again and find somewhere remote to land.
I'm happy to jump out. If I drop you in that field, are you happy to hurdle that gate at the far end?
Yeah.
Right, let's do that. And then it gets you two on the ground, doesn't it? She's got access.
She's got access, yeah.
Mark is squeezing HeliMed 99 onto a patch of scrubland.
Okay, we're down in central. You're cleared out, and I'll leave the disc up and running. Okay.
In cases of cardiac arrest, seconds count.
So this is Mark. Hi, Mark. 49 years old. Yep. Doing a half marathon.
Amazingly, after 3 shocks to his heart, runner Mark Weaver is breathing again.
So witness collapse, CPR from the onset, cardiac arrest. He's had 3 shocks in VF. Yeah. And we're now sort of with GCS 14, a bit confused.
Mark had barely covered a mile before he went down.
It's a half marathon, so it's 13 miles, and it is quite hilly, so it's quite a strenuous event.
Mark, can you hear me? Mark, hiya, Mark.
For 10 minutes, Mark's brain has had less oxygen than usual. He's confused and distressed.
This is a tricky one. Right, I'm going to drop some midas up anyway while we're deciding what to do. My thoughts, give him some midas, see if it calms him down, see what he's saturating like. If we're not doing anything, if that's not working, basically getting the ambulance and piss off. If it's not going to work, flatten him and get him in the aircraft.
In this instance, they think the quickest way to get him to hospital is by road.
24 minutes. Yeah, right. We're going by road. Yeah. Midazolam, DCA. Yeah. And if we need to, we'll pop him off to sleep in the way. Yeah, that's fine.
Mark's heart could stop again at any moment.
Thank you.
They're giving him a sedative to calm him down.
Mark, just relax back for me, you're all right. Hello.
99 from Medic 2. We're going to go by road to LGI. I'll update in a minute, so you don't need to don't land over.
Cheers, mate. We'll stay in the orbit for now until we know we're going to return to Nostell or fly straight to LGI.
He's going to be driven to the cardiac unit at Leeds General Infirmary. Brian and Pete will go with him.
Mark, how are you doing? You all right, mate? Mark, it's all right. You're all right. Calm down. Yes, thanks, mate. Just crack on. Don't worry about us.
Unless Mark calms down, they may be forced to anaesthetise him.
Had CPR delivered straight away. Ambulance is just round the corner. He's been defibrillated 3 times, and he's actually what we've got for hospital. So he's doing a spontaneous circulation. As long as that, he's actually got respiratory effort, and his level of consciousness has come up. So he's not unconscious, but he's very agitated. So to combat that, we've given him a little bit of midazolam just to calm him down, because obviously the more agitated he is, the more stress he's putting on his heart. So it's quicker in this case for us to get to him by road straight away, because we're struggling landing. We're going to take him to Leeds.
Despite being a runner, Mark is also a smoker. It's a major risk factor for heart attacks.
Mark? Mark?
Yes, I'm doing the run.
No, you're not doing a run. You were doing a run. You're in an ambulance now, Mark. You were doing a run, and then your heart stopped.
Come on.
Hey? I know. Just go with it, Mark. I know. We're not laughing. We're not having a laugh. Just go with it, Mark.
Dr. Brian wants his patient seen by doctors in the cath lab, where they'll clear the blood clot that is blocking flow to Mark's heart. But first, he'll be stabilised in A&E.
This is Mark. Mark's 49. He's been competing in a half marathon, collapsed, cardiac arrest, bystander CPR, downtime of approximately 10 minutes. DCA was a few minutes off scene. He's been shocked 3 times, initially VF. We arrived, GCS 13, obviously spontaneous rest and breathing. He's had 1 milligram of midazolam for post-ROSC sedation, and he's been in this state with us all the way through.
Mark's heart attack almost killed him, and his condition is still serious. Until the blood clot is cleared, he's vulnerable to another cardiac arrest.
And brief, we're just coming up and back.
It's 1 o'clock in the afternoon at Air Ambulance headquarters, and HeliMed 99 is being scrambled to a building site accident near Leeds.
Wind is actually slightly left of the nose, so we'll go at the top of the building. Okay. So that'll take us over towards straight over Horsforth, past the LGI, up the east side of Leeds Bradford Airport. Yep.
The accident has happened in a suburb near Leeds Bradford Airport.
Someone's cut the upper leg on an angle grinder and it's apparently spurting out. They put a tourniquet on it, it's time of it.
Dr. Paul Onion and the team will be there in 5 minutes.
So we're going to a gentleman that's cut his upper leg on an angle grinder. Sounds like there's quite a lot of significant bleeding at the time, and the people around have applied a tourniquet. So we just need to have a look, try and stop any significant bleeding, and we do carry blood on the aircraft if we feel that we need to give him a blood transfusion if he's particularly unwell.
The airport control tower has held flights to speed their arrival.
Suburban 99 Alpha, thank you. Surface wind at the airfield is 240 degrees at 11 knots. It's just off the edge of this high ground here. You can see the buildings now. It's just off the main road. Yeah, it is, yeah.
Pilot Steve is searching for the site. Then he spots an ambulance.
And it's 3 o'clock low now. DCA. Oh, roger. Edis 199 over at scene. They're just looking for somewhere to put down.
He's aiming for a patch of grass in the middle of a suburban estate.
That green space is looking good if it's too late. 4 o'clock now. Yeah, you've got light stanchion, no wires, I can see.
But overhead cables are threatening a safe landing.
All the wires stop at that pole, don't they? This one below, they all, there's one coming underneath us, but all the others are going to the left. Yeah. I'm deliberately just aiming closer to the ones I can see, and then we'll... Sounds good to me, Steve. I'll move you a little bit closer in a second. Okay, that's good. Nose is coming left, and we'll park the nose up the slope. There we go, that's good fine there, thank you. Alright, and landing on.
It's vital for the team to know which way to run to their patient.
Right guys, you are clear out, and you're clear into the 2 o'clock.
Steve's skill gets the team down safely. Builder David Dean is in a bad way. He was cutting concrete blocks when the angle grinder slipped and sliced into his thigh.
There's lots of clots under his trousers.
Okay, so it's not actively bleeding at the moment?
Not with this on, no.
Was it bleeding when you arrived?
No, this has been on the whole time. This wiring, so I've not released it.
Just pop a little drip in your arm, my friend. What do we call you?
David.
David, okay, then we'll get you some painkillers. Are you allergic to anything? Nothing.
He said it's just slipped and then obviously gone into his leg.
Workmates saved his life by putting the tourniquet around his leg, but he's lost a lot of blood.
Alright, sorry sweetheart.
Paramedic Sam must find out if the wound is still bleeding.
Right, if you want to just really slowly slacken that off and we'll just see if it bleeds. Just don't want to put a tourniquet on if you don't need to.
Sorry darling. Sorry sweetheart.
Okay, cool.
Clotting has reduced the blood flow.
It's not actively bleeding at the moment, Paul, so I've not tightened the tourniquet.
Do you want something to kind of immobilise his leg?
Just need we've got a pressure bandage we'll put on it. Just keep your arm really still for us, mate. You're not allergic to morphine, are you?
No.
We'll give you a bit of morphine to start with. If that doesn't cut the mustard, we'll give you something stronger.
But there's a danger the slightest movement could start the blood loss again.
Medic 3, ADAS update. So 62-year-old male, angle grinder to the upper right thigh.
They're applying a pressure bandage to the wound.
If you can just lift the leg up for us.
I'm just about to lift your leg up, Dave, darling, okay?
Tourniquet was going to be applied, but currently there's no significant active bleeding, but there is probably 500 ml on the floor. Obs are all within normal range, just getting some analgesia and antiemetic, and then we'll go by road to the LGI. Over.
Dr. Paul wants to take his patient by road so he can give a blood transfusion more easily.
Oh, bloody hell.
Are you going to come to them in the DCA? Are you going to go with them to LGI?
Yeah, that's affirmative. We'll travel in the DCA. Over.
Sorry, mate. It's going to be a bit sore. Okay.
It's like I'm in a poker.
Once this is done, we're not going to be moving. Okay.
Oh my God.
He's going to be taken to Leeds General Infirmary.
Oh, my leg. Don't need to lift up.
So can you roll onto your left side a little bit, and we'll move your leg.
Right, we're clipped in at top.
That's it. Right, you just relax there, mate. Okay. All done.
David owes his life to his workmates. The grinder cut to within millimetres of his femoral artery.
How bad is that pain, David?
It's about 4 now.
4, okay. Give me a little top up and then you'll go back to move you.
Probably about a 9.
Yeah, I can tell you're probably a bit of a tough cookie or whatever. I've been adding 5 to what have you been telling me anyway, so... All right. Right, I'm just going to slide you, mate, okay?
Now the race is on to get him to the major trauma centre.
On lift then, ready, set, lift.
He's lost a lot of blood, and it's feared he may have suffered major nerve damage. The team are looking for telltale symptoms.
David, wiggle your toes. Wiggle your toes.
Try.
Okay. Which foot am I touching?
My right one.
Cool.
The results are inconclusive.
Let me know when you're ready to go.
Yeah, good, thank you.
David's shivering is a sign of blood loss. He works in an industry notorious for injuries.
So just tell me what happened again, Dave. What were you cutting?
Yeah, I popped off at the block and it jammed and it shot out.
Right, okay, onto your leg.
Last time I did my knee.
You've done this before?
Yeah, I don't like the machine.
I probably wouldn't use it.
He's also been given antibiotics.
Infection's a big concern, obviously. It's an open wound, he's in a sort of building site. There's a lot of dust around, a lot of debris that can get into that wound. Obviously, before that, we're more worried about obviously major catastrophic blood loss. Obviously, the potential to cut an artery, the femoral artery, where that injury is very high, and if that happens, obviously, it could potentially bleed to death if you don't act within minutes.
They've brought donor blood with them, but so far, David hasn't needed it.
So what we've done, we put a tourniquet on your leg, but I've not tightened it up because it's not bleeding at the moment, so we didn't need to do that, okay?
Yeah, look, that's it. I saw it. Oh my.
Yeah, it's quite.
God.
Vascular surgeons are standing by to operate.
Headache, medic 3, right, LGI.
The air ambulance team's job is done. The hospital staff must now take over.
He's got a very deep wound to the inner thigh and his upper leg. The main worry at the moment is that he had a really, really weak pulse in his foot when we set off, and now we're struggling to feel that pulse. So we need to hand that over to the resuscitation team. He may well need urgent surgery to fix the blood vessels.
David's condition is very serious. Helimed 98 is heading home.
Okay, mate, seat blocks.
But back at base, duty dispatcher Sammy has an urgent mission for the crew.
98, are you able to head towards Royston?
Roger, heading towards Royston. Barnsley,
Roger, Royston Lane, RTC, 1 person, still in car, query pinned.
You got the pylons? Yeah, I got the pylons, mate. Thank you.
Just 3 minutes after the radio call, the team are touching down at an accident scene on the outskirts of Barnsley. Paramedic Tony and Dr. Andy are joining a complex rescue operation.
This is Gemma. Very anxious, very scared, very panicky. Pain across the pelvis, down the left-hand thigh.
Gemma Atkinson was being driven by a partner when the accident happened. She's trapped.
We've got a female patient in the passenger seat of one car that's trapped with pelvic pain. She looks quite pale. Then there's a second patient. She's got some tenderness over her sternum.
The passenger door was caved in by the impact. It's feared Gemma's pelvis is broken, and she's very distressed.
Get me out, please, get me out.
We'll get you out nice and quick if you just hold on.
Paramedic Tony is trying to reassure Gemma. and Hyde is concerned for her condition.
Please help me get me out.
Just try and keep nice and calm for it, it's okay.
The
numbers are all good, aren't they?
Yeah. ECG looking normal sinus, yeah.
Yeah, I mean, I think, like I said, the anxiety is going to play a big part in this, isn't it? So, I mean, whether we just try with a bit of Entonox, see if that will settle her, and
can do.
Dr. Andy wants her out of the car. Pelvic injuries can lead to life-threatening internal bleeding, but firefighters will have to cut her free first.
Main concern is pelvis. Yeah. It's okay now in the pelvis. Yeah, so keep it in line, move off and whatever.
The team want to give Gemma pain-killing drugs, but her anxiety is making things worse.
Try and relax, Gemma. Gemma, ideally, we would at this point put a little needle back in your hand.
Oh my God.
she's very anxious, very scared at the moment. So we're trying to calm her down. We've had a chat with the fire service, so we're going to create some space, take the roof off, and that would allow us to extricate her in a safe, controlled manner and manage any potential fractures that might be there.
Keeping their patient calm while the car is cut apart will require reassurance from Tony.
Do you want to get out, mate?
Yeah, we won't, not be long. We're just going to take the roof off and then we'll get you out.
Now the roof's off, they'll be able to extricate Gemma without worsening her injuries.
How's her hip doing?
Yeah, I mean, pain, like, a lot of it's anxiety. Yeah. It's when she's people shouting.
Yeah, that's a mum.
Once she's on a stretcher, Dr. Andy will be able to examine her injuries properly. A quick trip to drop her son at nursery has become a nightmare for Gemma.
I just want to sleep.
I know you do, sweetheart. We'll get you sorting in somewhere warm in a minute, okay?
I'm scared.
You're not to be scared, love. You're in the best hands possible.
Do you drop my dad ready now?
Yeah, it is there for you, so...
Firefighters have been trying to distract her.
My son, my mum will be back.
Is this cold?
He's only 2.5, is it, nursery?
Oh, bless him. What's he called?
Leo.
Leo. Are you happy with your life?
I didn't want children, he's the only one that I've got, and it's the best thing ever.
It is, love. It's brilliant having kids, isn't it?
She's calmed down quite a lot from earlier on, which is good. All of her observations are remaining normal again, which is good. We've taken some time just to create some space so that we can get her out of the car in a nice controlled manner.
Anybody not ready?
Now it's time to move her.
Just let yourself go back, Jimmy. No, I'm alright, I'm good. Get boarding now, start getting boarding.
Going in nice, that. Nice and solid. Just lean back for
That's it, just relax yourself. That's it.
Lean back nice and
okay.
steady, sweetheart. That's it, fellas, love.
Everybody ready? Yeah.
In position.
It's vital her spine and neck are kept still.
Right. Okay, sweetheart.
She's been slid onto a rigid stretcher for her journey to hospital.
So although Barnsley would be slightly nearer, we are going to fly us to the major trauma centre based on the mechanism and the possible sort of pelvic fracture.
It's feared the metal of the door hit Gemma's side in the crash.
The mechanics of the accident, she could have had some sort of force exerted onto the pelvic area. And if she has got a fracture, although it's not obvious that she has at this point, then you can get quite a lot of internal bleeding through the pelvis if you have fractured it. So that's his main concern, because that will take it to Sheffield Northern, which is a major trauma centre.
Lovely. If you can keep that arm straight, that helps blood pressure get more accurate.
Dr. Andy is keeping an eye on her blood pressure. A drop could be the first sign of lethal bleeding.
The problem is you can damage the blood vessels which run inside the bone, and then you can bleed a huge amount into your pelvis. You can bleed a very large volume very quickly. So we'll hand over to the trauma team, who have already been pre-alerted, and they'll be waiting for us.
Just 5 minutes after leaving the accident scene, Gemma's on final approach to the major trauma centre in Sheffield. She may need surgery. 160,000 people are injured every year on the UK's roads. But the emotional toll accidents take on victims is often forgotten. Research has shown 10% suffer mental health problems, like post-traumatic stress disorder or chronic anxiety a year following a crash. The rugged Yorkshire coast has a magnetic attraction for people who want to retire to the seaside. Scarborough's population is 10% older than the rest of the UK. And it means the NHS is kept busy, responding to the needs of pensioners often living remotely. Today, HeliMed 98 is heading for the cliffs near Filey, where a pensioner has been taken ill in his isolated home.
I'm not sure whether it was on the cliff tops or not. It was a bit of a spurious address.
Oh, right, okay.
77-year-old male did breathing.
I think I'm visual of the property now.
I can see a white house.
Yeah, with a caravan.
Yeah.
It's feared it may be a heart attack. Paramedics Lisa and James are on the case.
I'm just going to take you up there. I want you to jump out while the motor's running.
Right.
And then me and James are just going to go and reposition somewhere just out so we're not sitting in cloud, basically. Okay, auto trim, please.
Auto trim deselected.
Thank you.
Well good left, other than the sloping ground.
Yeah, Roger.
Lisa is heading out on a house call.
I'm not sure which is best way.
The man is with ground paramedics called to his cliff-top bungalow.
Hello? Hello? Is it you have come to see? Hiya.
Hi, Lisa.
Hiya. I don't know whether you need us.
No, I think we're all right.
78-year-old George Roberts has cancer.
Gentlemen, CA focal calls.
Hello, I'm Lisa.
After tea, feeling a bit breathless.
Okay.
Since we've got here, it feels a lot better.
George has had more than 40 hospital appointments for radiotherapy and electrochemotherapy.
11.4.
Right.
He's doing the 12 lead, and we're going to pop him through to Discover. Feeling.
He's fighting for breath.
ADS Medic 2 at patient's side now. Initial impression from DCA crew, they don't require us. I'll just give him a hand doing a set of obs.
The sound's a little bit consolidated at the back.
Right.
Right.
What's your name again? I'm rubbish with names. George.
They're trying to find out if he's having a heart attack.
Do you want me to do out?
No, I think we're just about...
If he is, the helicopter will fly him to a cardiac unit in Hull.
Have you had any recent chemotherapy?
Radiotherapy.
George's cancer is in his throat. It's made talking difficult and breathing painful.
Right, not in the recent past few weeks.
No.
Last year, the cemetery. Oh, for radiation, 20 sessions radiation.
Right.
No, everything went all right.
He's recently had some bad news.
I went last Thursday back to York. I know some scans, because everything ain't all right.
Okay.
George's friends and family have rushed to his cliff-top home.
I suppose you couldn't rule out early stages of sepsis just with his history. I mean, he's not had any chemo or all, has he? But he'll still go to Scarborough, won't he, from here?
Yeah.
Which came on first, your chest pain or your shortness of breath?
Shortness of breath.
Lisa is concerned he may have sepsis, an immune reaction that is often fatal.
It's a tightness. Tightness rather than a pain.
Is it when you breathe it just hurts or...?
George's wife was in the other room. She didn't even realise he'd dialed 999.
Oh, don't get upset. You've got a lovely view.
We have, haven't we?
How long have you lived here?
30 odd years.
Really?
I think.
How do you feel now? Do you still feel as short of breath?
No, better than what I did.
Yeah. Have you been coughing anything up?
Just.
Oh, sorry.
Is that normal for you?
Yeah, it takes medication for it.
Just maybe got a bit more than usual today.
It's decided George will go by road to the local hospital.
It's not every day an helicopter lands in your garden, is it? It's been lovely to meet you. So we're not going to fly you anywhere today. We've come to see you because you live such a long way out.
It will be less traumatic for him than a flight.
I needed help.
Yeah, of course you did. You've done the right thing. It's what we're here for. Don't hesitate in ringing us. It's what we're here for. All right, love.
All right.
But it's a house call Lisa and the team were happy to make.
Yes, so this gentleman that we've come to see, he's got a history of cancer of his vocal cords, and he naturally produces lots of mucus as a result of the illness. Today's had a little episode after his tea where he felt like he's produced much more mucus than he was able to shift, and that's been quite frightening for him because he lives in such a remote location. It was a long running time for a crew, so we've come out to see him as well.
The helicopter crew can now return to base.
Air Desk Medic 2, we're clear on scene now, just making his way back to the aircraft.
Yeah, what's your return to base? When you ready?
George will undergo further checkups when he arrives at hospital in Scarborough. Every year, 10 million tourists flock to the Yorkshire Dales to enjoy one of the UK's most picturesque national parks. And a lot of them are looking for adventure. Helimed 99 is racing south to one of Yorkshire's most bizarre visitor attractions, which has now become the scene of a climbing accident.
Through the Rocks is quite a local attraction around the Harrogate, Haintley Bridge area, and we tend to have quite a few fallers there. So there's somebody's appears to be rock climbing who's fallen, and the reports are they have an ankle injury. So we'll be there in just 2 or 3 minutes now.
Where that white car is, that's where I've had people where that crash mat is actually, but there's no one laid there, is there?
Pilot Gary is circling a series of rocks, weathered into unusual shapes by rain and wind.
Let me just land on and go, you can have a wander.
Brinham Rocks are run by the National Trust, and hundreds of visitors are watching the team's arrival.
Hang on, there's a guy here, that landing spot. It looks like he's trying to move people away. Yeah, so he's pointing to the people that you're going to land there.
He does look like he's a park official, doesn't he, running around with shorts on.
Yeah, he's trying to go away.
He's got his head on fire, so... Tail good, mate? Yeah. Tail's good. Okay, Sam, jump straight out, mate. I don't sure what they've got park officials here, so...
The rocks cover several acres, and Dr. Chris needs to find the casualty.
Hello. Oh, just lead us to them, is that all right?
Yeah, that's fine. It's quite a common place in Yorkshire for us to end up at, yeah. Bit of a local hotspot for falls from climbing onto all these boulders. It's a lovely location though, great place to go on a day out. Not quite so good if you're going to fall off and hurt yourself because it's a little way to the nearest hospital.
It attracts all sorts of visitors.
There's like a Return of the Jedi reenactment going on in the woods.
Their patient was climbing a boulder when he slipped and fell 15 feet.
Hello, young man. My name's Chris, I'm one of the doctors. How are we doing? What's happened then? What do you remember?
I was stood on that break there, the first break.
Yeah.
Lost my handholds, went to climb down.
Yeah.
That's about it, all happened too quick.
Did you hurt yourself anywhere else?
Nowhere else.
Just your ankle?
Yeah.
Okay, and what's your name, sorry, buddy?
I'm Josh.
Josh, okay.
Josh Bowers has dislocated his ankle. His climbing mates saw him fall.
He was just getting to the top of this boulder here, and just as he went to go, he couldn't quite top out, so he ended up falling off. And he did fall fine, he landed on the crash mats, but as he landed, he went over on his ankle. There was an awful snapping sound.
You've got a dislocation of your ankle there, okay? What we need to do is to give you some painkillers and bob it back, okay? The skin's really tense over it, so it does need to go back sooner rather than later.
Blood isn't reaching Josh's foot. If his ankle isn't put back into joint, he could lose it.
So what we'll do is give you this Entonox, okay? So you need to just take some nice slow deep breaths in and out of it. It only works when you're actually sucking on the Entonox. It wears off within sort of a few seconds, really. So if it starts getting a bit sore, just breathe nice and deep, okay? Is that all right? Yeah.
Putting it back into joint using controlled force will be agonising.
Right, so what you need to do is if you put your hands there, kind of interlock them, so that goes like, okay, yeah, just put a little bit more behind his knee. He's absolutely locked in.
Josh is tough. He barely flinches.
Okay, good. So you see it only work there when I sort of bend it a bit more. Okay, so splint it up. Put your leg nice and straight for me.
Josh's foot is out of danger now. Blood is once more flowing.
Good pulse.
He's even fit to walk again.
Team leader, from our point of view, I'm happy if he was to hobble. Yeah, I'm sure. With assistance, one on each arm. You want to do that?
Yeah. Sometimes we turn up and see it, it's clearly obvious what the injury is, and it was quite dramatic. It was pure 90 degrees with his ankle. So he's been quite lucky to come off the top. He's landed on the crash mats after initial assessment, you know, and some Entonox. I think he was gritting his teeth a little bit when the doctor was sort of realigning it, but once it goes in, it's sort of immediate relief.
Josh is off to A&E by road for x-rays. It's been a painful afternoon.
Brand new shoes, brand new trousers, been lucky shorts now. Not quite the same, but yeah, all right now. In good hands anyway.
Back in one piece nearly.
Yeah, definitely back in one piece.
For the Air Ambulance team, it's back to base. Josh's ankle injury didn't turn out to be quite as simple as it appeared.
About 2 weeks later, we found there was actually a fracture on the back of the ankle. So they put me in a walker boot, got me straight to physio, and then I was just sat for a couple of weeks, probably about 2 months in total, not really able to do anything.
It meant he had to put his high-risk hobby on hold for a while.
Originally, the consultant told me that I might not actually climb again, so I was really concerned that I wouldn't actually get back to doing my sport. So I ended up doing physio 3 times a day, every day, for a good 2 or 3 months.
But he's now back on the rocks and taking a bit more care.
I'm now back climbing twice a week at the moment. Not quite at the point I was at, but I'm happy to be back, and it's slowly increasing. But I'll just take it easy. I don't want any more injuries. I'm done for now.
Pensioner Julia didn't recover from severe internal injuries she suffered in a collision on the A19. The driver of the van that hit her car was jailed for drink driving. Doctors found a blockage in runner Mark's heart, which caused his cardiac arrest. He was also suffering from pneumonia. Amazingly, he returned to work just 3 weeks later. Builder David needed 20 stitches to repair the gash in his leg caused by an angle grinder.
You can't hold him right, it's a little awkward, and it shot back and then straight into my leg.
He has been left with some loss of feeling due to nerve damage, but it could have been a lot worse.
The day after operation, he says it were a milli off your artery. He said, oh, it nearly got your bone. He said, it nearly hit your bone and all. That were a shock, that were. Kids come see me, I told them, I said, it were a milli off my artery. I could have been dead now, and you'd have been organising my funeral for a millimetre. Very lucky, very.
Car passenger Gemma's hip was broken in 2 places and left her unable to walk.
I had to sleep in a bed downstairs. I had a Zimmer frame, a commode. It was really different. Everyone had to help me have bed baths and help me put my clothes on.
But it wasn't long before she was on her feet again.
I can't run, so obviously I can't run after Manacle Boy, but I can do other stuff with him. I can go up and downstairs, upstairs to his bedroom and play with him. I can get on the floor.
But she's thankful for her rescuers.
It would have been a different story if they didn't come, and I'm so grateful for the air ambulance that saved my life, so I can still be here to look after my son.
Sadly, cancer patient George passed away surrounded by his family, 11 months after the air ambulance dropped in on his clifftop home.